Assalamu alaikum. My name is Dr. Sumera Abbasi. I'm from an anatomy department, and we will be studying today the teen joints. So, our objectives are by the end of the lecture, the student should be able to define the term joint. They would be able to describe the classification of three types of joints and give along with the examples. They would be able to describe the characteristics of the synovial joints, the classification of synovial joints, and along with the examples, and they would be able to list the factors which are maintaining the stability of the joints. And by the end, there is a Hilton's law for nerve supply of the joint. So the definition, what is a joint? It is a site where two or more bones meet together, right? So there is one bone, there are two bones. So where is joint? This is the joint where two bones are meeting together. So as a general rule, there are fibrous joints which are immovable. There are synovial joints which are freely movable, and most cartilaginous joints are slightly movable. Now, the classification includes the joint could be classified by two ways, according to their structure, according to their function, and according to the region. Now, the joints are classified according to the tissues that lie between the bones, which includes the fibrous joints, cartilaginous joints, and synovial joints. Now, the structural classification is based on the way bones are held together. And the functional classification includes the based on relative joint mobility, how they are moving. So, the synovial joints, fibrous joints, and cartilaginous joints are all examples of structural classifications of the joints. The synovial joints includes, in this, the bone is separated by a joint cavity, which includes the synovial fluid, includes in the fibrous joint capsule. The examples are shoulder, elbow, carpal, hip, knee, tarsal joints, interphalangeal joints between articular processes of the cervical to lumbar vertebrae. Then there are fibrous joints. In this, the bones are held together by a collagenous fibers extending from the matrix of the one bone into the matrix of the next. There is a new joint cavity. Examples: skull sutures, teeth in the sockets, distal radioulnar joint, tibiofibular joints. Now, the cartilaginous joints are bones. These include the bones that are held together by a cartilage. Again, there is no joint cavity in the cartilaginous joints. Examples include epiphyseal plates of long bones, costo-sternal joint, pubic symphysis. Now, the functional classification is based on relatively joint mobility. Now, these include diarthrosis, amphiarthrosis, and synarthrosis. The diarthrosis are freely movable synovial joints. Examples include shoulders, elbow, carpal joints, hip, knee, tarsal, interphalangeal. The amphiarthrosis are slightly movable joints. Examples: intervertebral disc, joints between the articular processes of the cervical to lumbar vertebrae. The costo-sternal joints are from ribs 2nd to 7th, between the ribs and the sternum. The pubic symphysis, the distal radioulnar joints, and tibulofibular joints. Then there are synarthrosis, the joints with little or no movement. Examples: skull sutures, teeth in the sockets, epiphyseal plates of long. Now, the fibrous joints are the articulating surfaces are joined by a fibrous connective tissue where there is no or very mild movement. These include the skull sutures, which are temporary joints as they ossify later. Inferior tibulofibular joints, there's minimal movement. Then these are permanent joints. Then there are gomphoses, which are dental alveolar joints. Now, the cartilaginous joint, in this, the two bones are joined by a cartilage. It is of two types. There's the primary cartilaginous joints and secondary cartilaginous joints. The primary cartilaginous joints includes the bones are united by a plate or a bar of hyaline cartilage. And there, in these joints, there is either no movement or there is basically no movement, and they are temporary joints because they ossify later. The example includes between the epiphysis and the diaphysis of a growing bone. Now, between the first rib and the sternum, there is a first sternum costal joint. Now, the secondary cartilaginous joints are some persons. These includes the bones are united by a plate of fibrocartilage. In this joints, their articulated surfaces are covered by a thin plate of hyaline cartilage. There is either very little movement or there could be no movement. These are permanent joints. These are called midline joints. The joints between the vertebral bodies, intervertebral discs, or symphysis pubis. Now, the synovial joint, the characteristic features are these are freely movable joints because in this, the two bones are joined by a fibrous capsule which is attached to the margins of articular surfaces and enclosing the joint. So there is a capsule. There are articular cartilages. And after this capsule, there is the margins of articular surfaces. These are enclosing the joint. The articular surfaces are covered by a thin layer of hyaline cartilage, which is articular cartilage. The joint cavity is enclosed and it has synovial fluid. The features of synovial joints includes articular cartilage, fibrous capsule, synovial membrane, joint cavity, extracapsular ligaments. The fibrous capsule, synovial membrane, articular cartilage, hyaline cartilage, then there's a joint cavity which includes the synovial fluid. The fibrous capsule is the joint surfaces are enclosed by a fibrous capsule. The capsule is lined by a synovial membrane. Now, the joint cavity inside the synovial membrane, there is a lubricating fluid which is synovial fluid. Now, there are reinforcing ligaments. These ligaments are usually reinforced. The fibrous capsule is usually reinforced with these ligaments. These are basically extra capsular ligaments. What is a synovial membrane? This is a thin vascular membrane lining the inner surface of the capsule. The synovial fluid is a lubricating fluid produced by a synovial membrane. In the joint cavity, the fluid minimizes the friction between the two bones and it allows the mobility of these joints. The classification of synovial joints is the arrangement. The synovial joints can be classified according to the arrangement of the articular surface. The range of the movement that are possible. So according to the range of the movement, synovial joints are classified into plane synovial joints and axial synovial joints. The plane synovial joints are the articulating surfaces are flat and the bones slide on one another, producing a gliding movement. The examples are intercarpal joint between the two carpal bones. Then there is a sternoclavicular joint. In between the sternum and the clavicle, this is sternoclavicular joint. And there is the acromial process of scapula and the clavicle. There is the acromioclavicular joint. Now the axial synovial joints movements occur along axis. The transverse movement, longitudinal and anterior posterior. In transverse axis, there is a flexion and extension. In longitudinal axis, there is rotation occurs. And anterior posterior, there is abduction and adduction. The axial joints are divided into uniaxial, biaxial, and multiaxial. The uniaxial joints include hinge joints and pivot joints. The axis of hinge joints is transverse. The movements occur on hinge joints as either flexion and extension. The example is elbow and ankle joints. Now the pivot joint, the axis is longitudinal. The movements are rotation. Example include radioalloy joints. Now the biaxial synovial joints include ellipsoid joints. An elliptical convex fits into an elliptical concave articular surface. The axes are transverse and anterior-posterior. The movements include flexion and extension and abduction and adduction, but rotation is impossible. The biaxial synovial joints include saddle joints. The articular surfaces are reciprocally concave and convex. They resemble a saddle on a horse van. The movement are those as of ellipsoid joint flexion, extension, abduction, and adduction, but there is a small range of rotation. Examples are carpal, metacarpal. Polyaxial synovial joints are ball and socket joints. There is a ball-shaped head of a bone that fits into the socket-like concavity of an inner bone. The movements include flexion, extension, abduction, and adduction, the rotation along a separate axis. The examples are shoulder joint and hip joint. This is an example of shoulder joint. Hip joint, where is a ball-shaped head of one bone is fitting into the socket of another bone. And now the stability of synovial joint depends on the shape of articular surfaces. The ball and socket shape of the hip joint is a good example of the importance of the bone of shape to maintain a joint stability. The shape of the bones forming the knee joint has nothing to do with stability. Now, the stability also depends on the strength of the ligaments. Basically, the strength of the ligaments to prevent the excessive movement in the joint. Example, cruciate ligaments in the knee joint. The stability also depends on the tone of the surrounding muscles. In most joints, it is the major factor controlling stability. The short muscles around the shoulder joint keeps the head of the humerus in the shallow glenoid cavity. Now, what is the nerve supply of the joints? The capsule and ligaments receive an abundant sensory nerve supply. The Hilton's law states that a sensory nerve supplying a joint also supplies the muscle. Now, moving the joint and the skin overnight the instructions of these muscles. What does the Hilton's law states? It states that a sensory nerve supplying a joint also supplies the muscle moving the joint, and the skin overlying the insertions of these muscles. So, thank you so much.